If you know me, you probably wouldn't be surprised to hear that I practiced in Wyoming. But Warsaw, that would raise an eyebrow. It was my dream job. It was my first practice after completing residency. And I was in a rural dairy farming community of Warsaw between Buffalo and Rochester, population 10,000. It was the home of the Apple Pumpkin Festival and Letchworth Gorge, the Grand Canyon of the East. I was an important part of that community, just like the dairy farmers, the plumber, and the mechanic. One of my first patients was Jack Mulligan. The Mulligan name harkened back to the Western New York Central Railroad, where Jack's father worked, and many before him. And before that, his people built the Erie Canal, which paved the way for settlers going to the Great Plains and beyond. Jack was a strong but gentle outdoorsman with great love for his family and had 2 large dogs. He was sort of the big brother I never had. One day, I was driving and my pager went off. So I reached down for my cutting-edge cell phone technology. I was glad I didn't have to find a payphone, and I probably didn't have a quarter on me anyway, so I was thankful to have that piece of technology with me. But I thought, boy, wouldn't it be cool to have a Dick Tracy 2-way wrist radio to communicate with everybody? But I said, oh, I'll never see that in my lifetime. I called the ED, and Bruce Middendorf, one of my favorite ED docs, was on. He said, hey, Paul, I got a man in room 6. He had some kind of an episode. You're going to have to see him. And it was unusual for Bruce to be that vague in his description. It had been a very snowy day with wind chill near 0. Jack was a heavy but muscular man in the gurney. And he went on to explain how he came to with an elbow on the roof of his car and an elbow on the door of his car, and he had wet himself, which was new for him. So as a doctor new out of training, I said, this sounds like a seizure. We started him on the usual seizure medicines, got an EEG and a CAT scan, but some of the medicines were causing strange side effects, and his heart rate would take off. We really didn't have a good explanation, but maybe it was a coincidence. I got a neurology consult, but our local neurologist, good though she was, didn't have an answer, so she referred him to a renowned neurologist in Buffalo. That neurologist said, I'm not sure what this is. I think he should go to the seizure center in Rochester. The hospitals in Rochester were sort of our local Mayo Clinic and held in very high regard by everyone. And at that hospital, the neurologist said, I think we need a 10-day video EEG to make sure if this is a seizure or not. I'm not sure I would recommend that to any of my worst enemies, to be honest with you. You're trapped in the hospital for 10 days with 30 wires attached to your scalp, chest, and limbs while being confined and videotaped the whole time. But at the end of all that, the neurologist came to Jack and said, Mr. Mulligan, you don't have seizures. Well, what do I have then? Well, maybe you're depressed. I'm depressed because I don't know what I have. He says, well, at least we can tell you that you don't have seizures. That began a longer and darker course. Over the next few months, Jack followed up. He had had some severe burns on his arm. He didn't realize what they were from, other than he had worked with a work lamp. You see, he couldn't even feel the burning from that hot lamp on his arm. He had other areas that were not able to sense even painful stimuli like burns. And he had a lot of brain fog that he was dealing with. Imagine watching a friend suffering like that, and despite all your training, you couldn't even help him. And all the experts of your area had failed you. They had nothing to add. It was a dark time. Jack came in at a follow-up visit, and he shoved a magazine into my hands, and he said, hey, Doc, what do you think of this? I had never had a patient bring in a magazine for a diagnosis. I was used to reading sheets of papers printed off from the internet, but never a Discover magazine. Said, my mom found this and she thought it might be a good idea. Maybe something we hadn't thought of. I smiled at the idea that his mom was still trying to help after all the experts really didn't have much to say. She must have loved him very much. I told Jack at the end of reading the article that it was a very rare disease, and it probably wasn't the answer, but I frankly didn't have any better ideas, so I went forward with it, and I could do the testing, and so I did. Sometimes it's difficult to accept that people with very little training might have other ideas, like Jack's grandma. There'd be other times, like when I was rounding a children's hospital and Glenn, the janitor, stopped me as I was rounding. You could tell he was a little hesitant, but it's a great compliment when people feel free to say something like that to you. Glenn said, "Paul, that patient looks sick to me." I knew that this time, but what about the next time? You see, Glenn did his own rounds. He visited every patient on that ward during his rounds as a janitor. And he didn't have an MD degree, but he sure knew what he was doing. Sometimes listening to people like that is one of the most rewarding things that we can do. You could have knocked me over with a feather when the testing came back positive for Jack. He had a diagnosis of acute intermittent porphyria, a very rare disease in which the synthesis of the hemoglobin molecule is defective. And when it's active, the precursors of the hemoglobin back up, and those are poisonous to the nerves. It can mimic almost anything. That accounted for the weird drug reactions and his fast heart rate, I thought. I was really excited. But as I thought about it again, I said, I really felt that I had failed Jack. You see, I had a name for his disease, but I couldn't do much about it. There really wasn't a good treatment. I referred him to Roswell Park in Buffalo, which is a renowned cancer center. And the hematologist there enrolled him in several NIH drug studies. He was put on the cutting edge medicines of the day, none of which did anything. It was very discouraging. Jack, on the other hand, he was ecstatic. He had a name for his disease. He owned it. He struggled with the idea that all these symptoms were in his head. He did his own research and read that a high-carb diet could actually reduce some of the symptoms of the porphyria. I hadn't come across that. Welch's grape juice to the rescue. Welch's grape juice did more for his symptoms than anything else, any of those NIH drugs or anything else. Excuse me. But that's not the end of the story. As I was rounding in the hospital another week later, one of the psychiatrists came over to me and said, "Hey, Paul, I heard you made a diagnosis of acute intermittent porphyria." I said, "Actually, it was the patient's 82-year-old mom who read a Discover magazine." I said, well, that doesn't matter. I have a patient I've always thought might have acute intermittent porphyria. And I told him immediately, I said, the chances of two people in a town this size having that disease are infinitesimal. He said, well, nonetheless, I'd like to look. Can you help me? I said, sure. I can tell you what tests to order. I can help you interpret them. But I'm just telling you, it's really, really improbable. And in preparing for this talk, I did the math. I didn't realize at the time, but the chance of two people in a town that size who are unrelated, and they were unrelated, is 1 in 70 followed by 13 zeros. 1 in 70 trillion. No, I didn't buy a lottery ticket that day. But this time I knew who to send the patient to. Jack Mulligan, of Warsaw, New York, population 10,000, had joined the American Porphyria Foundation and became one of their best educators. He was recognized at a national level for the quality of his listening and teaching, as only one with a rare disease speaking to another with rare disease could do. He went on to do great things. And he was invited to NEOMED to give a talk here on what it was like to be a patient with a rare disease. And unwittingly, he encapsulated a quote by Peabody, which says, "The secret of caring for the patient is caring for the patient." Could it really be that simple? It was a bit hard to accept that listening to Jack's mom's medical advice was one of the best things I had done in my career. I couldn't cure him. I couldn't even diagnose him. His mom did that. Nonetheless, naming his disease allowed him to go on and help so many other people. How many cures, solutions, and innovations do we lack because we don't listen to the right people? And my charge to each of you here tonight is lend a listening ear to any caring person, because you can learn something from anybody. Hey, who knows? Maybe you could be the next one in 70 trillion. Thank you.